Everett Page is the former CEO of Matthew Thornton Health Plan, and Everett's going to talk about what it looks like from the insurance side of the fence.
Yeah, I will warn you that the past few years I've spent most of my time working with large hospital systems in major metropolitan areas. But I will go back to the insurance side. And let me start off by saying what we think about the uninsured. Frankly, Scarlett, we don't give a damn. Here's the problem is this. Judd is going to charge my health plan more if uninsureds go there. As long as he charges every other health plan more, what do I care? And let's start with what is the role of insurance? Way back in the 90s, some Martian came and delivered the idea that insurers should manage health care, not doctors. And that was the HMO movement. And the reason that happened is simple. Employers could pressure insurers, but they couldn't pressure a fragmented healthcare system. Now, so we ended up in that role which the public unanimously rejected. And rightly so. So now we go back to the fact, what are we? We are, as an insurance industry, and I'm using we, I'm trying to speak for the industry, financial intermediaries. We don't care what the cost is, as long as we know what it is. Then we mark it up with our admin and we pass it on to you. So if unnecessary procedures are done, or if a lot of people show up at the ER and there's a lot of uncompensated services, then what we get charged by healthcare providers goes up. And that goes into premium. So I want you to come away with this with one thing in mind. Health insurers pay nothing. We take the costs from the providers. Hopefully we estimate it correctly. And then we add on our admin and our processing fees. And I will admit, you can argue with those, but we have a horrible system that developed some years ago when we tried to use billing and claims data to capture medical data. So now, I think, correct me if I'm wrong, but I think the average medical practice has 3.2 non-provider employees for every provider. It's about right. And a lot of it is because of this archaic coding and collections and whatever. So that's a lot of money spent on the provider side, not to mention the insurer side, reconciling it, for no good reason at all. Now with electronic medical records, we need to start talking about dumping this artificial billing system, which kills everybody. Now, I said insurers don't care about the uninsured. We just keep marking up the cost. There are some caveats to that. Number one, if there are too many uninsureds, we don't lose business. And that's what insurers are seeing with layoffs and everything else. So if employers can no longer afford insurance, then we're going to see our market dry up. Number two, insurers do better with large risk pools, lots of people, because you can estimate the cost better. Which I'll throw in a little dig here. I think states and the federal government are some of the dumbest entities when it comes to providing health care that I've ever seen, because they split up their constituencies into different risk pools. So if you look at the state of New Hampshire, state employees, there's the university system, there's municipal employees, whatever. All the different risk pools, I guarantee you, that means because just on an underwriting basis, they're going to have to pay more because there has to be that cushion. At the federal government, there's the congressional plan that all the federal employees have, Medicare, Medicaid, military retirees, all in different risk pools. Crazy. So the fewer risk pools, the better, and the less margin the financial intermediary has to build in to cover the unexpected. So I'm going to leave you with one thought that I'll come back to when it comes to the future. We can beat on insurers all we want, and sure, insurers have done some crazy things, and the government did some stupid things with Medicare Advantage and the Social Security drug benefit. They made insurers rich. Foolishly so. Didn't have to happen. But if we focus on insurance, let's assume we pull 10 percentage points. We lower medical costs by 10% right now, because we just go and shoot half the people in every insurer. And we have a new system and it keeps running. That won't stop the rate of growth, because the rate of growth is coming from an aging population and from what's happening within the medical system. So while we can, it's easy to hate insurers. I do sometimes. And it's easy to hate drug companies. The reform has really got to come from the medical delivery system. They need to control it. God forbid we should ever go back to the idea of insurance-led managed care. And the more we focus on insurance and drug companies, and less on how we deliver care, which these folks have talked about, the more we're going to keep kicking the can down the road. And someday we're going to pay. So we don't care. We'll just keep marking it up.